The Third Man Factor: Surviving the Impossible by John Geiger is a nonfiction exploration of the sensed presence experience, an unseen companion that feels real, guiding, and often life-saving in extreme situations. For someone thinking about schizophrenia and hallucinations, it offers a grounded, experience-first way to think about voices/presences without forcing a religious or psychiatric label onto them. The book documents scores of real cases where climbers, polar explorers, sailors, astronauts, and disaster survivors feel an extra person with them, often during exhaustion, isolation, or life-threatening stress. This third man may speak, give instructions, or just be silently present nearby, and the people experiencing it usually experience it as distinctly other, not just a thought, but a companion. Geiger traces these reports from Shackleton's Antarctic expedition through modern mountaineers and trauma survivors, asking what these similarities say about the human mind under pressure. Psychologically, the third man phenomenon overlaps with what psychiatry would call a hallucination or felt presence. But Geiger emphasizes that it can happen in people with no mental illness history when conditions, isolation, fatigue, fear, sensory monotony, stack up. Seen as a survival mechanism or emergency resource of the mind, rather than automatically a symptom of disease, feels much closer to how those with schizophrenia describe their voices. A psychiatrist reviewing the book calls it a fascinating treatise on non-pathological hallucinations, pointing out that psychiatry usually teaches very little about these experiences outside of illness labels. Why it can feel more accurate than many schizophrenia novels. The narratives Geiger uses are messy, contradictory, and uncertain. People are often not sure later what was real, what was internal, or how to explain it, which mirrors the ambiguity many long-term patients talk about. The presence is described as situational and pragmatic, showing up at crisis points, giving very specific guidance or comfort, then fading, which is closer to how many people actually experience voices. Because Geiger isn't trying to push a "this was schizophrenia" or "this was an angel" verdict, it leaves space for the reader's own interpretation, which can be especially helpful if you live with a diagnosis but don't feel your experiences are fully captured by medical language. If you hand this book to someone as a window into the schizophrenia-adjacent experience, you can honestly say it shows how real, grounded, and useful a presence or voice can feel from the inside without reducing it to either just symptoms or just spiritual